The common myth is ulcer is a serious disease. The fact is the ulcer is a very common problem and it can be easily treated. We have very good and appropriate medications which should be combined with the right diet and the right lifestyle changes. So it is not a serious disease and it's not a disease to be worried about. But we need to take adequate precautions and adequate diet changes as per the consultation by the doctor. Common myth is ulcer can lead to cancers. The fact is only less than 10% of ulcers are really cancers and very rarely or almost negligibly ulcer can lead to cancer. At the time of diagnosis, normally we take a biopsy. If the biopsy is normal, forever they are cancer free and they will not have any cancers. Common myth is once you are diagnosed with ulcer, you have to be on treatment forever. Fact is the ulcers do not require any long-term treatment. It depends upon the type of the ulcer. Normally we give treatment for 2 to 3 months. Once treated, then you have to combine it with the lifestyle changes, dietary changes, avoid having stressful lifestyle, having adequate sleep can treat ulcers in more than 90% of cases. So ulcers do not require any long-term treatment. Normally in most of the situations it can be treated with 2 to 3 months of treatment. Myth is drinking soda, drinking cool drinks will reduce the symptoms of acidity in acid peptic diseases. Fact is sodas and cool drinks will worsen the symptoms of acidity or acid peptic diseases. The reason is initially it might absorb the gas production in the stomach, but it will eventually lead to excess acid production and it can lead to excess reflux and excess heartburn and excess chest pain in some patients. So soda and cool drinks to be avoided in patients with acidity problems. Common myth is drinking water excess with food or otherwise drinking excess water will reduce the symptoms of acidity. The fact is people who have got acidity should restrict the water. No one should drink more than 2 to 3 liters of water unless they have some kidney stones related issues. But as far as acid peptic disease is concerned or acidity is concerned, they should restrict the water intake with the food. Especially along with food, they should restrict the water up to less than half a glass while eating and up to half an hour after eating. So drinking excess water with food will aggravate the acidity symptoms, and the fact is restrict the water intake with the food which to improve your acidity. Fruit juices are good for digestion. This is a common myth. The fact is fruit juices will worsen the acidity because fruit juices will stimulate the acid production thereby, and also fruit juice will causes the ileus relaxation in our stomach, thereby increasing the reflux and heartburn and chest pain. So fruit juices are to be avoided. This is the fact. Fruit juices are not to be taken in people with acidity. Fasting will improve acidity. This is a common myth. The fact is the people who have got acidity should avoid fasting combined with binge eating. The best way to overcome acidity in people is with having acidity problems is taking a diet in a small frequent intervals, avoid eating late night snacks, avoid eating excess food at a time, and avoid sleeping after having meals, and drinking excess water to be avoided along with the meals. So fasting will improve acidity is a myth, and the best way to overcome is the fact is eating should be in small amounts in a frequent interval. Common myth and fear among the patients is all patients with acidity should rush to the doctor for immediate treatment. The fact is acidity is a very common problem. Almost everyone in his lifetime can have acidity, especially with sometimes with excess eating. So acidity should not be taken it as a serious disease. Acidity once if it happens once in a while should be treated with dietary changes and lifestyle changes. And in some patients, it can be treated with over-the-counter medicines on off and on basis depending upon the symptom. For those people in whom acidity persists despite all these measures, then only they should approach doctors for evaluation, diagnosis and treatment. So, myth is commonly acidity is taken as a serious disease and consult a doctor immediately. And the fact is acidity is a very common prevalent problem and you should not consult doctor unless it is a very persistent and becoming a prolonged illness. Thank you.